everyone. Good afternoon. Today, let me tell you a story about a young lady. Let us call her Mrs. Gita. She is in her early 40s. She is staying with her husband and a school-going son. Her son is very talented in cricket. He has won a lot of awards in inter-school cricket tournaments. She is a professional working in a private firm. She is perfectly healthy. She has got no medical conditions. She does not have any addictions like smoking. And she is physically fit, physically active. She's a regular in her gym and her yoga class. In fact, she's planning a trekking trip with her friends 2 weeks down the line. Mrs. Gita has been having some minor health issues over the past 2 months. She's having a vague chest discomfort. She's having a dry cough. And she's having a nagging backache. She thinks that it's probably some infection, maybe a chest infection, and a course of antibiotics would set her right. And she visits her family doctor. She very rarely visits any doctor, but she has to because her trip is coming up and she wants to be perfectly okay before going on that trip. Her doctor examines her and orders a chest X-ray. That X-ray shows a shadow in her lung. Her doctor realizes that it is not just an infection, it is something much, much sinister. Mrs. Gita is sent to a multi-speciality hospital for further scans and further tests. Her scan is not good news. It reveals a lung tumor which has spread to the bones of the spine. That is the reason she was having that vague chest discomfort, cough, and that nagging backache. A biopsy is performed which confirms the worst possible diagnosis, lung cancer. Mrs. Gita is told, you have advanced lung cancer, you have stage 4 lung cancer. Imagine the uncertainty, the fear of the patient. A week back, she was leading a normal life like any one of us. She was actively employed lady, she had her family life and her social circle. And now these minor complaints have led to this devastating diagnosis. Mrs. Gita's family, friends rally around her. They offer her comfort. They accompany her for doctor's appointments, help her to navigate the healthcare system. But in spite of their presence, Mrs. Gita feels alone, isolated. Her life had been irrevocably altered with this diagnosis. Cancer is one of the most important health problems of the 21st century. More and more young people like Mrs. Gita are being diagnosed with cancer. As per National Cancer Registry data, in India, 1 in 9 individuals will develop cancer during their lifetime. The reasons behind this explosive rise in cancer cases is related to lifestyle changes and environmental changes. And it's not limited to traditional risk factors like smoking and alcohol. In fact, 10 to 20% of cancer patients, lung cancer patients, have never smoked, like our patient Mrs. Gita. Cancer has become so common that many of us would encounter it somewhere in our lives, in ourselves or in our loved ones or friends. As a medical oncologist, I see patients like Mrs. Gita on a daily basis. The cancer patients usually, if they are detected early, at an early stage, they are completely cured. But still, many patients are detected at advanced stage, where cancer has spread to distant organs. It has metastasized, like our patient. Patients hail from different backgrounds, they have different lives. But in an advanced cancer patient, some questions remain the same. Doctor, how are you going to treat me? Am I going to get better? What are the side effects? But perhaps the most heartbreaking question is, how much time do I have left? Now, let us go back in time in 2005, when I was just 2 years into my medical training. My MBBS started in 2003. What would have been the answer to these questions in Mrs. Gita? Advanced lung cancer was treated with chemotherapy, conventional chemotherapy. It is a powerful weapon even now, but it had its own side effects: nausea and vomiting, fatigue, hair loss, and the quality of life of the patient was compromised. And the outcome of this harsh treatment was also not great. The overall survival of advanced lung cancer treatment with conventional chemotherapy was 7 to 8 months only. Mrs. Gita would have spent her time going to the hospital to receive her chemo infusions and then back home managing the side effects. She would have been stuck in this endless loop between home and hospital with no time for her family, her friends, or her job. And in spite of all of this, the overall outcome was grim. Fast forward back to the present in 2025. What has changed? When I expressed an inclination in a career in oncology, my own doctor colleagues said, that isn't it a depressing field? Isn't the treatment even more harsh than the cancer itself? Are you sure of your decision? But now in 2025, I know that I am sure of my decision. It was the right decision. What has changed? Cancer treatment in various domains has transformed. For example, if we talk about surgery, robotic surgery, a surgeon guiding a robot, has led to a more precise and a more accurate surgery with early recovery, because the robot hand does not have limitation of movements like the human hand has. Radiation treatment is more precise. The surrounding organs are not damaged and long-term side effects are less. But a transformative change has also happened in my field, medical oncology. And the medical treatment of cancer has been revolutionized. The most important development, and the credit goes to preclinical researchers, pathologists, has been the understanding that cancer is not same in everyone. Cancer is personal. It has different characteristics in different individuals. You cannot treat cancer with a one-size-fits-all approach with chemotherapy. You try to do better. And this is something which has changed in the mindset of doctors. For example, in 2005, the lung cancer was classified according to how it looked under the microscope. So you had small cell lung cancer, non-small cell lung cancer, and various histologies like adenocarcinoma, squamous cell carcinoma, large cell. But essentially, the treatment for all of this was the same: chemotherapy. Now, in 2025, we know that lung cancer may harbor all these genomic changes or mutations like EGFR, ALK, BRAF, MET. And every cancer can be treated in a personalized manner with a different targeted therapy. The one-size-fits-all approach has gone. What is the benefit of this targeted therapy? Targeted therapy will only work on cancer cells which are harboring certain mutations. It will spare the normal cells, leading to lesser side effects. But it's not only lesser side effects. The efficacy of targeted therapy is much better than conventional chemotherapy because of a rapid sustained shrinkage of tumor which lasts for a longer time, sometimes in years. This is one of the most important developments of advanced lung cancer treatment. But not all lung cancer patients harbor these mutations. Targeted therapy may not be an option for everyone. For those patients, another important therapeutic development has been the advent of immunotherapy. Cancer is essentially our own body cell which has acquired mutations and is keeping on growing and forming a tumor. The body does mount immune response against this tumor like it would for any other bacterium or virus infection. But cancer cells have a devious mechanism of blocking and evading this immune response and continuing on their relentless growth. We have certain drugs called checkpoint inhibitors, which remove the brake on the immune system and allow the immune system, like the T cells, to act against the tumor and to destroy cancer cells. And the results are again revolutionary. Some lung cancer patients, advanced lung cancer patients, are surviving. 30% of patients are surviving beyond 5 years with immunotherapy. And the reason for this sustained sort of control is the memory immune cells which keep on acting to keep the cancer in check. We all have undergone vaccination in childhood. That vaccination prevents infections sometimes for a lifelong. And this is the reason, because there are memory immune cells which keep on working. Same goes for cancer patients. And again, immunotherapy is given as a short IV infusion, no more prolonged hospitalizations, and again does not have the side effects of conventional chemotherapy. Coming back to conventional chemotherapy, it is often vilified, but we are able to deliver it even now in a much better manner. It is an integral part of treatment. Why is that? Because we have learned to use the conventional drugs in a better, more smarter manner. For example, the modern anti-emetic medicines have reduced significantly the rates of severe nausea and vomiting. There are newer techniques called calculating technology, which reduces the blood flow to the scalp when the chemotherapy is going on, thus reducing the drug exposure to hair follicles and minimizing hair loss. So not just the modern medicines, but the older medicines are being used in a better, more tolerable manner. And this has led to differences not only in survival outcomes, but also improvements in quality of life. Now coming back to our patient, Mrs. Gita, you might be thinking that this is a very sort of sad story, predictable sad story with a sad end in an advanced cancer patient, but it is not that. Mrs. Gita's tumor was analyzed. It was analyzed in the pathology lab with a technique called next generation sequencing, and it revealed an ALK mutation, which I had mentioned. Only 7% of lung cancer patients, non-small cell lung cancer patients, have that mutation, but the presence of that mutation can make a remarkable difference in the management of patients. Mrs. Gita got an oral pill, an ALK inhibitor targeted therapy, and the outcome with ALK inhibitor targeted therapy in today's day and age, the survival is reaching approximately 7 years. Remember, it was 7 to 8 months in 2005. With this targeted therapy, the outcome is 7 years. Some of these targeted therapy agents, ALK inhibitors, are keeping the cancer in control for around 5 years. 60% of patients are remaining in remission for 5 years or more. This is the impact of ALK-directed therapy. What difference did it make in the patient's life? Mrs. Gita did not go to the hospital for prolonged chemotherapy infusions. No side effects, no hair loss. Within 2 weeks, she started feeling better. Her backache went down, her cough went down. Within 1 month, she took a break. She went on that trip with her friends, and she was back at her job. And after 3 months, the scan revealed that almost 60% of her tumor, of her cancer, had come down. There was a good response to tumor, and she continues to be well. She continues to lead a normal life. But more importantly, what about the future? In 2005, she would have probably looked ahead and maybe expected to live for a few months. But now she can look forward to enjoying a few years of a healthy, fulfilling life. She can even dream that one day her son might play cricket professionally, maybe represent the city, the state, or even the country. Something which would have been impossible 20 years back is now possible. This is the change in cancer care. There are still milestones to be achieved to make cancer care more affordable, accessible, prevent cancer, and also detect cancer at an early stage. But for me as a doctor, even now, I am satisfied with the progress which we have achieved because I am able to offer much, much more to my patients. Cancer patients in 2025, even advanced cancer patients, are not just surviving, they are thriving. They are leading fulfilling, wholesome, normal lives with hopes, dreams, aspirations like anyone else would have. Thank you.